Good afternoon. Thank you very much for having the time to be with us today. I'm very happy to see you because some of you I never seen before because you are our new alumni, and around 14 of you I have seen before because they joined our one-year online diploma in the previous years. I'm very proud of this program. It's Diabetes Blue Points project, which is very important for us because it is helping improving access to quality and equitable diabetes care in Africa. And we all know that in Africa there is a big challenge of diabetes, and I don't see why this is happening, because diabetes is a condition, can be prevented and can be treated and managed, and people should not die from diabetes. And as we know, all of us, people are not surviving HIV and hepatitis, but die from diabetes and cardiovascular medicine or hypertension, which should not be the case. But because of the lack of trained, skilled healthcare providers at all levels that can manage and prevent and early diagnose diabetes in Africa and some of the developing countries, this is a challenge. So as a Merck Foundation CEO, we decided with the Board of Trustees to start a program since 2015, actually, to train. First, we started with training medical students about diabetes management. And it was a very concise program, 1 or 2 days, but it was very helpful. Then I said to myself, no, we need to create a platform of experts, skilled experts in diabetes and in cardiovascular. If you know also that we have the same program in preventive cardiovascular medicine. Started with providing 1-year online diploma to African and Asian doctors who freshly graduated and who are passionate to specialize in diabetes. And this 1-year online diploma was very, very informative, very beneficial, that everyone who graduated can actually start his own diabetes clinic in his center or in his hospital and be the diabetes expert in his community. And then we evolved from this to make a nationwide Diabetes Blue Point project, where we, in partnership with the First Ladies of Africa, Ministries of Health of Africa, or diabetes societies across all the 3 continents, the global south, to provide us candidates from across the whole country. So it's not only from the capital, but from all the provinces and districts, as much as we can. So if you look at the map at the end of 4 years, maybe, you can see Blue Point. Each doctor will graduate and be able and capable to have his own diabetes clinic or to be the diabetes expert in his community constitute a blue point in the map. So by the end of 5 years, you see the whole map is blue, because will be a lot of experts from across the continent. This is not an easy program. It is very difficult. It's 1 year, but it's full information about whatsoever you can meet about diabetes. And who graduate with distinctions and merit can continue with a master degree. And that's why you see with us also candidates who joined our master degree, which is 1 year following the diabetes diploma. And then you will have 2 years of diabetes management from South Wales University in UK. So now I will finish here, and I will start to invite one by one for your intervention to tell us about how this training course impacts your career, the access to diabetes care in your community, in your country. And some of you will speak about the challenge of diabetes care in his country as total as well.
the moment when I was chosen, I thought I was going to travel to the University of Southwest to undergo the program. I was never exposed to an online program before. So, I actually asked myself, what am I going to do? What am I going to be studying diabetes for a period of 1 year? So, but gradually when the course started, I discovered that it was a very interesting course. So, and I discovered that working at the same time and studying online was very, very difficult. So I needed self-discipline is what I needed in order to be able to complete the course. When I really mean self-discipline, because we know the problem of a shortage of doctors in Africa and all over. And considering you have to go to the hospital every day and consult maybe 30 patients, you come back, you are very tired, you are called for an emergency, and then you have to attend to the emergency. So I must say it's a course that requires a lot of self-discipline and very rewarding.
For anybody who thinks that the online course is, going to be easy, it's not easy. You need to invest a lot of time into it.
Effort, yes.
And for me, it had to be a routine. So because you're working at the same time doing the course, you need to find 2 to 3 hours a day at the right time, and then try and then stick to that time. So if it's early in the morning, that's you'd want to stick to that time. If it's after work, 2-3 hours after work, after you lie down, stick to that time. It has to become part of your life.
We have a lot of patients coming in to our polyclinic with diabetes, and luckily for us, I actually have one of my mentors. She's done with the diabetes program through Merck, the Merck Foundation, and she introduced me to the course and told me that it was a good idea for me to do it. And yeah, sorry?
The name of the doctor?
Dr. Roberta Lamte. She's actually my consultant. Yeah. Okay. So she told me about it. I got excited about it because I really like to know the right way of doing things.
Very good.
Yeah, so when she told me about it, I got interested and I applied. And so far it's been great. I've learned so much that I didn't know before, and it's even helping me in terms of patient care. I have patients that I'm seeing, and I think I'm managing them better now than I used to do before.
So it's true that I finished my diploma in 2017, and then I finished my master's in 2019, and it has opened a lot of doors for me. The diploma as well as the master's. Number one, I'm able to do diabetes care at a comfortable level, and there are many patients who have benefited from my expertise when it comes to matters to do with diabetes. At my place of work, we've been able to establish a diabetes clinic that was previously not there in Mombasa. Where we were seeing patients, at least patients was being seen haphazardly, but we were able to harmonize the diabetes care there. So it has been, I've been involved in, the Kenya Diabetes Study Group, where, there are a number of conferences and research papers that we are doing. We've been involved in diabetes training for nurses and for clinical officers, and also for fellow medical officers. So it's actually opened a lot of doors for me, and so for all the the people who've joined the diploma this year, I can assure you that you're in the right path. And as our colleagues from Cameroon and Ghana have said, I think you can see that it's actually, worth the time as well as the effort.
The course is going on well.
Very good.
With the 6 weeks that we have started, I have already started to pick snippets that I've realized I've already started to incorporate in my patient care. I work both in an outpatient setup, and I'm also a critical care doctor. So I'm able to apply the knowledge on both sides of my work. So it's going on very well, and I'm really appreciative of what the course is taking me through.
I know we have been having patients who have got endocrine problems, but I remember one case scenario that we admitted for more than 3 months in the hospital, and the patient was basically dying. And that was before I started my training. And it was just a random test that was done, and we found that she had a Sheehan syndrome. And this was manifesting decades later after the last delivery. So I can imagine the number of cases that we've missed. But I must say that my engagement in the PDIP in endocrinology has changed me. It is like a 360 turnaround because aside of the cases that have got endocrine problems, I'm also giving better attention to the other case scenarios that I'm having. I recently had a young man who had non-specific symptoms, and I actually almost sent him away from the clinic. But then he got admitted, and I think he is having an endocrine problem, which I proposed for a test. I'm amused, I'm amazed also that I can pick it out.
Did you? And he already had the test came out, and he had the problem. You diagnosed it.
Yes.
Amazing. And treatment, everything was okay.
Everything is going on well, and I'm just happy about the training because
I'm so happy about this. You know, even one life you save, it's worth it. Yeah, it's worth it. So I'm so happy about this. Thank you very much, Dr. Florence. You gave us a highlight of the day. That yes, with this success story from the early times, like 6 weeks only. Imagine about what we're gonna do afterwards. Thank you very much, Dr. Florence. I wish to see you soon. Are you in Nairobi?
I work in an inpatient and outpatient setup of the University of Nairobi, which is a public institution. Yeah, in Nairobi. But I plan to move out of Nairobi and go and work in the remotest parts of the country and offer this care to people.
Are you sure?
Yes.
Are you sure?
Yes. Yeah.
Great, Dr. Florence. Thank you very much. Thank you, Harvey. Thank you.
So since I have started doing this, especially in the rural part, the people were not aware of this particular condition, and they normally refer to it as sugar sickness, and they consider it as a curse, especially in the rural part. So I first started to make awareness of it so that we can have more patients. And as I started the process, I started to train the nurses, especially from what I have been learning from the Merck program. From the University of Southwell through Merck Diabetes. And I was able to get, right now as we speak, the diabetes, there's a session in Ganta where they treat diabetes people, we screen them, and we're able to treat them. For now, we are still progressing on the drugs because we have the availability of drugs like metformin and the sulfonylureas are the only ones that are here in addition to insulin. Like drugs like the sodium glucose transporter 2 and the GLPs are not available, but it's good that I have been exposed to them. So once they are, the few that we have around, I'm able to administer them, and I have been the only person who will be able to use them and know the indications for them.
My name is Martha Joseph. I am currently a junior medical officer working at the Intermediate Hospital of Katutura in Windhoek, which is the capital city of Namibia. Really what has really been my passion for endocrinology is because I've really seen that there's been yearly review of guidelines for HIV and TB. However, we have not had any guidelines in the sense of treating diabetes or other endocrine disorders. And really, I did identify a deficit in the knowledge of diagnosing and managing endocrine disorders. And really, this course has been so beneficial. And really, I feel like the universe is really working with me really in this course, because as the weeks progress, really, I've been getting patients with the exact same conditions that we are addressing for that week. So it has really been amazing, and I'm really already putting everything in practice.
I'm so thankful that Merck Foundation found it fit to choose some of us to join the diploma diabetes. I'm telling you, managing diabetes now is so much effortless, and my patients have benefited a lot. I have shared this knowledge with my colleagues, nurses, and doctors. I work in a district hospital. So I see most people who come here are from rural areas. So we go there in the rural areas to go and manage diabetes, then share the knowledge with the nurses who manages these people there. So just this COVID has messed up our plans. But
Yes.
once everything is set, we'll go back and finish what we started.
So the reason of why I'm choosing this diabetes management, because in Malaysia, diabetes management is majority of them are being managed in our primary care setting. About 68% of our diabetes patients are being managed by primary care. So actually, at the same time, I'm the head of the unit of diabetes team in my clinic that managing about 1,000 of diabetes patients. So with the program, I hope that I can be better in terms of reducing the clinical inertia that I noticed that some of my colleagues are having some issues in terms of managing diabetes.
Yes.
So as we know that clinical inertia allowing this, it prevents we giving this patient from getting proper treatment for the first 6 months of they being diagnosed. So I hope by acquiring this knowledge, I can be better in terms of managing the team and also improving the knowledge and also management of care in my practice.
Okay, so I'm Dr. Lopade. I work with Lagos University Teaching Hospital, which is in the southwest part of Nigeria. And I'm grateful to Merck Foundation to be part of the endocrine diploma course for the next 1 year. I think it has been wonderful, challenging, exciting, and also it has also made me to be more disciplined with my time, because it's really challenging managing your work fronts with your research work, then with learning newer things that even though you've read before, but there are newer things that I'm still learning from this particular course.
I'd just like to be honest, Doc. First, I was really hesitant in joining this program since I am a fresh graduate and I have not had a lot of interaction with diabetes care.
Mm-hmm.
Yes, and also, Doc, my experiences with diabetic patients are based from my internship. So, and during my experience, Doc, I was able to see the negative impact of diabetes to the families. I have seen patients coming inside the emergency room with diabetic foot. Others are already going to be amputated. And when I also had a rotation in the community, I have seen patients who are uncompliant with their medications since because of financial burden. And with this course, I feel that I was able to learn more and dig deeper onto the other types of diabetes that I wasn't familiar with. And I feel that this course will help me become a competent physician.
Thank you for the opportunity that has been given to me to complete my postgraduate diploma, and then now I'm about to complete my master's in diabetes. Special thank you to you, Dr. Rasha, and the Merck Foundation. Coming to the benefit of this course, there are many, but this course helped me to think somehow differently to the way I can orient and advise the minister or the Minister of Health for the better way of the management of diabetes in Rwanda. So, you know, there is the shortage of medical doctors in Rwanda and elsewhere in Africa. And sometimes our patients may do long distance to travel to reach the services in the hospitals, just only for medicine refill or just for blood glucose monitoring. So that has many times impacted to the lost follow-up, and most of them didn't know even their diabetes, or they have to go to seek medication. So what we advise the ministry, and that is being implemented, we decentralized and integrate the diabetes care into the existing health system, but all of those was coming from the cost I have had, interaction with my tutors and colleagues. We work together, we have studied together. So then we had standardized guidelines and tool algorithm for just easy for even not necessary a nurse, not necessarily a medical doctor can treat or follow up patients with diabetes. So then we established a system from the community level where we have the community health workers can sensitize population for risk factors, mostly basing on age, category, family history, obesity, kind of just to go to health facility, to health center to seek for screening and early detection. So whenever you are suspected for diabetes or any NCDs, mostly for diabetes, so you were just sent to the hospital just to be diagnosed and by medical doctor, and they initiated the first treatment. And whenever you are stable at the hospital level, we follow up for trained medical doctors. So you have been sent back to your nearest health center just for follow-up.
Okay, thank you, Dr. Rasha, and thank you, Merck Foundation, for giving me this opportunity to study diabetes in great depth. Because when I was in medical school, we learned about diabetes and we saw patients with diabetes. But now that I'm doing this course, I'm getting an in-depth knowledge, and I'm so excited because I'm getting to know things I never knew about. I'm getting to know NODAT, I'm getting to know LADA, I'm getting to know MODI. These are things I might have heard and I've forgotten, but now I'm getting to read about them and do further research on them. So I'm so excited and I'm happy about the course. And I look forward to getting more knowledge.
Yes, actually, the Society for Endocrinology in Sudan, or the Sudan Endocrine Society, is relatively new, 2-3 years ago. And actually, I heard about this diploma from other colleagues in the past. That's a great educational content and so on. The service in Sudan, endocrine service, is emerging. It's relatively new. Most of the people were mainly working in diabetes more than in endocrinology. So as soon as I heard about the Merck sponsorship for this diploma, I was very excited to join in, as this it's relatively the certain conditions, but now this is evidence-based learning. It will be very useful in helping our patients, and I'm teaching in a university as well. I'm working in teaching hospitals.
So you can transfer this information.
Yes. This will reflect on training medical students and medical registrars, and carry on the knowledge to the next generations.
Yes, so when I graduated from the diploma course, first of all, it changed my mindset, because most of the times we practiced medicine according to the day-to-day lifestyle. We didn't bother about knowing the patient in a holistic approach. So after the diploma course, really, it made me look into something else, and I could really speak to them in all aspects of their life, including their mental health and also their lifestyle, rather than just prescribing medications and letting the patients go.
Currently, I'm in charge of diabetic clinic, and I started mentoring my colleagues the few things I've learned. Wow. I've realized that we have been delaying to start patients on insulin and putting them on too much medication. And the burden on the physician has reduced, because currently some of the complications, I can manage them just with the 6 weeks program. And I'm thinking, and in our quality improvement plan, I've suggested to have the diabetic same is continuous medical education, which I'll be presenting depending on the knowledge I've gained.
I'm very happy because last 2 months, I have been selected for 1 year postgraduate on diabetes diploma of University of South Wales. And I think after 6 weeks study with my tutor is Shalini, Dr. Shalini from India, and a lot of colleagues from all over the world, I think is a very good opportunity for me to building my knowledge to cure my diabetic patients. And I have a chance to learn a lot of valuable experience from you. Thank you so much.
Okay, I'll take you back a little bit because I just can't help it. I really have to show my gratitude towards Merck Foundation because, hello?
Yes, I'm here. Thank you very much.
So what it is that I diverted into public health, in particular cervical cancer screening. That's what I was doing. Then I was posted to a facility in Kabwe, Central Province of Zambia. That's where I was working as a public health specialist. But when I got there, I realized that there was quite a huge number of patients who were diabetic and the management was not up to date. So I ended up seeing patients, and then I realized that in as much as I was seeing patients, there was this knowledge gap that I had. So when I received the call that I was one of the awardees of the scholarship, I was really elated, really happy to be part of the team. I won't lie to the new members of the team. It's very involving, but in as much as the course is involving, it's very interesting and it's an eye-opener. I really enjoyed it and I'm looking forward to the master's degree as well.
Okay, so I'm a doctor, a young doctor working in rural Zimbabwe and doing the 1-year diabetic program.
Yes.
What I've noticed is since I've started working in my area, it's very rural, if I should say. We are having so many patients coming in with complications, especially most of them that are coming with complications of diabetes. Yes. And the challenge that I've noted with most of them is just lack of knowledge, basically, if I should say. These people are never screened. They only realize that they have a problem when it has reached the end stages. So I think what really needs to happen for us in our setup is more health education, trying to educate our population on diabetes in itself, and to encourage health-seeking behavior, because we are
lifestyle, which is very, very important.
Yes, and lifestyle changes.
So how we are doing in the course and the diploma, Dr. Muriel? Is doing well with you?
It's okay. It has been challenging, if I should say, because it was a new experience, online learning and the whole thing. It was very new for me, and the major problem that I've been experiencing is where I am. It's still quite remote, so here and there I have problems with my internet connection and this and that. But despite that, I'm managing, and it has been interesting and very, very, very eye-opening.
So I think now we have to close our session, and I'd like to thank you all for being with us all this time. This is great opportunity to know each other, meet each other, and also to connect with each other for the future. Because I don't want, after even we graduate, that we lose connection, we lose contact. We still have to continue sharing information, sharing experience, network, research, update with each other, and solutions of different challenges, new guidelines being developed here or there to be shared with us, with each other. Even during the studying of your module and you have any challenge, someone else maybe can help that he overcomes this challenge or find a solution for something in the module. This is very important, the Diabetes Blue Points program of Merck Foundation, nationwide program. We are addressing endocrinology and diabetes diploma and master course for the people who graduate with distinction and merit. That's why I encourage you that not everyone will have the master opportunity. Only the people who will graduate with distinction and merit who will have the opportunity to go through the master course as per the guidelines of the scientific committee. So there is no exception at all. So I wish that you study hard and take it very, very serious so you can graduate with distinction and with merit. Also, people who will fail the module number 1, they will be disconnected from the scholarship as also per the scholarship of guidelines. So make sure that you don't fail any module and take it very serious from the beginning. It's not only for you, it's for the people around you and for the community around you. They deserve the best. They deserve to have access to all the information, the technologies and the things that they are available for other patients across the world. So you are your tool, and this is an opportunity that was very important, and we very happy that we can provide it, but you have to take it very seriously and make use of it because it will transform your career, you transform your community, the quality of life and the saving lives of your patients, but also transform the landscape of healthcare in the public sector and healthcare in your countries and Africa and in Asia. This is for sure. This is for sure. The number is too huge. It is 74. Today we have 74 countries, but we have 400 from before that joined across all the online diplomas. And this is not a small number in 35 countries, in 3 languages, in English, the French, Portuguese, and Spanish, 4 languages. So it's very, very important. We did not leave anyone behind. And in rural area, not only in the capital, not only the main hospitals, it's all across the country, different provinces, like we always advise, as much as we can. The program in partnership with the First Ladies of Africa, Ministries of Health, and medical societies, either diabetes or endocrinology society in your country. Thank you, thank you, thank you very much. I wish you great luck and success. We will be following up with you to see how you're doing in your modules, the impact of your studying and your graduation, and how you will continue with your master if you have distinction and merit. And of course, you can access us at any time. You can approach us at any time. You have, I would like to introduce my team quickly. The Kandar, Dr. Kandar, the scientific and medical manager of Merck Foundation. Is he here?
Hello,
Dr. Kandar?
Hello, Dr. Rasha.
Yes. So Dr. Kandar will be the one who will help you if you have any challenge on your module and connect you with the right people. We have also the mentors that he is connecting you with, that they can help you also from your colleague. Vino Nair is the Vice President of Merck Foundation and the head of APAC region.
Hi, everyone.
Asia region. Hello, Vino. How are you?
Hi.
Hi.
Wish you all the best, everyone.
Thank you.
Do well.
And Leonard
Thank you,
Saiko
Doctor.
is the Senior Director of Merck Foundation and Head of Africa. Leonard? Leonard?
Hello. Hi,
Hello.
hi.
Can you put your video?
Yes, I'm here.
You can see. Yes, you are in the. So Leonard is enjoying the open air. I envy you, Leonard. I envy you. So it's great. So Leonard from Kenya, and he's helping you all, not only Kenya, but everyone. So, and now we have Dimple Shastri. She's Senior Manager of Merck.
Hello.
Programs and projects. Hello. Dimple is the one who prepared all these links and all these events and our events in general and our programs and our meetings, everything. Thank you, Dimple, very much.
You're welcome.
Thank you. And we have also with us Veronica, the head of my office and the protocol, head of protocol, and also the partnership manager. Veronica.
Good evening, Dr. Rasha. Good evening, everyone. Welcome to see here. Very nice to be present at this video conference.
I know it's an exhausting day, but we'll go back home now, so don't worry.
No, everything is fine. As you said, where there is passion, there is energy, and there is everything.
Yes. Thank you very much.
Thank you. Thank you. All the best for everyone.
And we have Marakuti, the community awareness manager.
Hello everyone.
Hello, hi. Thank you. So, and also we have Sagar.
Hello everyone. Good evening, Dr. Rasha.
Good evening, Dr. Rasha. I think Mehak is not here today. Mehak is not here, or she's here.
No, she's not here today.
Not here. Okay. And we have Janini.
Hi.
Kanga. She is the community awareness manager. She has, the beautiful green background behind her to show the community feeling.
Thank you, Rasha.
And who else with us now? We have Anup is here. Jaya's here. Jaya's here.
Yes.
Jaya,
hi everyone.
Hi, Jaya and Anup. Anup, how are you? Anup is our IT manager, and he's responsible for all our technologies of our operation. Thank you, Anup. Thank you. And Jaya?
Hi, Rasha. Hi, everyone.
Hi, Jaya. Jaya is also our administrative and administrative officer of our Merck Foundation. Thank you, Jaya. Thank you. Who else I'm missing? Am I missing anyone from the team? Because I don't have the list with me. Anyone missing? No. I don't think so. Finished. Okay. Thank you very, very much. And introduce you to the team. And if you need anything, you can approach us anytime. Thank you and have a great day. And have a good luck. Thank you very much and great success. Bye-bye. Bye.
Goodbye. Thank you.
Goodbye. Thank you.
Bye.